Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. The flu's here. Yes, it's been in the area. While maybe not rampant yet, it's only a matter of time. In other states, it sounds like it is hitting, and hitting in a hard way. Joining us to talk about the flu is Megan Meller, Infection Control. Thanks for being here.
Thanks for having me, Chris.
Unfortunately, we got to have you talk about the flu a little bit.
Every year.
Yeah, and I know that, you're going to say get that flu shot right away. People worry about the effectiveness, et cetera, but for the pediatric population and the elderly population, it's huge.
Don't forget the pregnant population, too. That's another big population that we really want to make sure they're vaccinated during this time of the year.
Yeah, got to stress that. Talk about the flu, though, being in the area. Only a couple of cases reported at Gunderson Health System, but that's kind of the tip of the iceberg from what I understand.
Yeah, I mean, there's confirmed cases, and then there's cases of people, out in the community where they're not actually going in for medical attention because, they're just fighting it off at home, which is, perfectly fine. So usually the confirmed cases is just kind of a snapshot of what's actually going on in the community. We know from state reports that activity is starting to kick up a little bit in the southeast western region, so like the Dane County part of the state. So, at that point, it could just be a matter of time before we start seeing an increase in cases here. But we take it at a week, just week by week.
How bad is it out there? Every year the flu has a different strain. So I know you mentioned before we went on air here that there were places, other states where deaths are reported.
Yeah, other states are starting to report, a pediatric death here, there, or just an adult death. But overall, I haven't seen anything to suggest that the flu is ramping up throughout the country, which is encouraging, but that could also change, in a matter of weeks too.
Right, especially as we go into the holiday season where people are having more contact with people from other, areas of the country.
Absolutely, yeah. After during those holiday seasons is when you start to see cases ramp up, just because there's a lot of mingling going on, which is, what we want to see happen during this time of the year. But then it also means this, number of colds go up and flu cases go up.
One of the questions that I have to ask you that I know you get asked about all the time, including from your dad, and that is, okay, I had the flu shot and I feel weird for a couple of days. Some people say I'm sick after I get the flu shot, so I don't want to get the flu shot. It's not really getting sick. Can you talk about that aspect?
Yeah, so it's really your body just reacting positively against this vaccine. It's seeing, okay, there's this flu virus circulating, I have to mount a response. And so that's how you get the antibodies to develop. So that way when you do get sick from the real thing, you already have that protection. Your body's reaction time can be a lot faster to that specific illness, disease. We hear the same thing with shingles vaccines too, that people are like, man, that second shingle shot, I just felt like death. I just did not want to get up, that second day. And it's their immune response. It's doing what it's supposed to do. And so that's what I always try to remind people. If you're truly full blown sick, it's likely you already had something from before that was kind of incubating. But if it's just a mild kind of under the weather, something feels off as you put it, it's likely just your body putting, just developing a good, healthy immune response.
Hopefully your dad is listening here then to this. Talk, if you would, a little bit about the difference between flu symptoms and cold symptoms, because a lot of people will say, oh, I had the flu last year. Probably wasn't the flu.
Probably wasn't the flu. And also another thing I hear is the stomach flu. People confusing the upper respiratory flu with the stomach flu. And in that case, if it's the stomach flu, you're more likely it's another virus that mainly affects the gastrointestinal system. Now, in the pediatric population, vomiting and diarrhea can occur with the actual flu virus, but that's still relatively rare, and it's even rare among adults. Now, differences between cold symptoms and the flu is, for the flu, your symptom onset is going to be really rapid, whereas with a cold, it's going to be a little bit more gradual. You'll more likely have a fever with the flu, less so with a cold. And, just overall, like those chills, like that headache that people report with a flu, you're not going to see much with a cold. With a cold, it's going to be more like localized to, you're going to get congested and stuffy nose, like that.
Nasal cough, that
Nasal
kind of stuff.
cough, yeah.
All right. We're talking with Megan Meller, infection control at Gunderson Health System. And one thing we should say is there's still time to get your flu shot.
There is still plenty of time to go get your flu shot. I feel like I can't stress enough. The Gunderson Flu Shot Clinic is open until the day before Thanksgiving, so the 21st. So go get your flu shot if you haven't yet. There's still plenty of other locations within the region that will offer flu shots past that time. Even including Gunderson. There's always still primary care providers who always have the flu shot available for people who want it. Our pharmacies will continue to offer it past that November 21st time. So there are still plenty of options available for people who cannot make it to the cutoff.
No matter where you get your flu shot, it's still important for you and for others in our community.
Oh, absolutely. Yeah. I always like to stress to people, you're not just keeping yourself safe, you're protecting those who can't be protected. There is a large population in our community, those who are under the age of 6 months, who cannot be vaccinated. So their protection against the flu is either from their maternal antibodies, because antibodies can be transferred through breastfeeding, and they can also be transferred through the womb, which is, again, why we want pregnant women to be vaccinated. But then it's also just who you're surrounded by. If your loved ones are fully vaccinated, then it's less likely that you're going to pass the flu on to this young child whose immune system, frankly, is still developing and still learning.
Interesting. Now, I know that we're talking to somebody in infection control here, but I'm going to throw you a big softball. You can hit this one out of the park. So, holiday season is upon us. Not feeling well, got a cold or the flu, let's just say it's a cold, but you want to hang out with your relatives who you haven't seen for a year or longer in some cases. What do you do?
And I can see this being a hard one, just, I'm thinking about myself, where would I be in that situation? Because you really want to be with family. You don't want to be alone during the holidays. But at the same time, I think you need to think about who you're going to be interacting with. If you know that if you're on the rebound where the worst of it's over, you're starting to recover and your family is safe, your family not safe, your family's pretty healthy, then I would go. But still, be aware, proper sneezing etiquette.
Sure.
Don't just making sure you're washing your hands. Doing simple steps like that can really go a long way in keeping you healthy from other people. I've had family members who are like, "Oh, I'm sick, so I'm not going to kiss you on the cheek." Yeah, that's perfect. Or no, I'm not gonna I'm not gonna hug you because I'm still getting over this. Yeah, that's.
But we can still be in the
perfectly
same room and have a conversation.
But we can still
yeah.
have that, at least that FaceTime, which is really important during the holiday season.
All right.
Now, if you're, like I said, just sick as a dog, high fever, it's best just, even from your own personal standpoint, just to stay home, because holidays can be stressful, and stress can make it harder to recover from some of these illnesses. So even if it's just taking a day or two to say, you know what, I'm just going to lie low here with my Christmas cookies or with my holiday meal. And then, once I feel better, I'm ready to mingle. That's great. It's really listen to your body and know what your family needs. If your family needs to be, if you have a sick grandparent, just be mindful of that.
Excellent point. Megan Meller, thanks for joining us.